Dogs with liver disease often show liver enlargement. In dorsal recumbency, with the transducer in the ventral midline sagittal position, the liver should fill about half of the ultrasound screen from the left or cranial aspect to the right or caudal aspect. If it extends to the right side of the ultrasound screen or beyond, the liver is enlarged. Note that the liver extends beyond the right side of the ultrasound screen in this video. Liver enlargement is also indicated if the liver extends over or beyond the ventral stomach, as shown in this video. With severe enlargement, the liver can almost fill the abdomen, as in this cat with biliary cystadenoma. The liver extends from the diaphragm to the urinary bladder. In dorsal recumbency, with the transducer in the ventral midline sagittal position, the liver should fill about half of the ultrasound screen from the left or cranial aspect to the right or caudal aspect. If liver tissue fills less than half the screen from left to right, the liver may be judged to be small. This general guideline only applies when the patient is in dorsal recumbency. A small liver can result from portosystemic shunts. In this still image, the gallbladder looks large, but the volume measurement is normal. The liver does not fill half of the ultrasound screen and seems to line the diaphragm in this shunt dog. In the transverse plane, gallbladder volume and size is found to be normal, and this makes the liver look small. The liver can be small and hard to find in dogs and people with cirrhosis. The liver will have a cluster of grapes appearance. A large amount of abdominal effusion will be present. In cats with cirrhosis or hepatic fibrosis, the liver will not be small. It will be normal in size or mildly enlarged, but hyperechoic. A surgical wedge or laparoscopic biopsy is indicated for cirrhosis in a cat. Consider a liver biopsy if the liver is abnormal in size for any patient. This liver extends over the ventral stomach, suggesting enlargement, but still has an angular or pointed caudal edge. In this video, the liver extends over the stomach and is rounded or blunted at the caudal edge. This dog has suppurative hepatitis and shows an enlarged and rounded left liver. This dog with a hepatoma has an enlarged and very rounded right liver. This dog with cirrhosis shows abdominal effusion, a mixed echoic cluster of grapes appearance, and a rough and irregular liver surface. This dog with metastatic neoplasia has an enlarged and hyperechoic liver with a large nodule at the caudal edge of the liver. Consider a liver biopsy if the liver is abnormal in shape. In this video, the arrow points first to the falciform fat and then to the liver. The liver is homogeneously hyperechoic compared to falciform fat. In dogs, this can occur with hyperadrenocorticism excessive estrogen or progesterone, fibrosis occurring with chronic liver disease, hepatic lipidosis, amyloidosis, and some neoplastic diseases, especially lymphoma. In cats, it may be seen with hepatic lipidosis, chronic liver disease, some neoplastic diseases, and hepatic fibrosis or cirrhosis. Liver biopsy is needed to determine a definitive diagnosis. In this video, the arrow points to the hyperechoic walls of a multiple intrahepatic portal veins. These veins are prominent because the liver parenchyma is hypoechoic. This appearance is known as starry night because of the portal veins. Note the hyperechoic spleen caudal to the liver. A diffusely hypoechoic liver, or individual liver lobes, can occur in dogs or cats with diffuse neoplasia, lymphoma in this case, acute toxic injury, or thrombosis or torsion of a liver lobe. Distinct nodules in the liver of dogs tend to be benign, but could be neoplastic. Liver nodules in cats tend to be neoplastic. In this video, the liver is generally hyperechoic compared to falciform fat. There are several hypoechoic nodules measured. The liver is also enlarged. It fills the ultrasound screen, extends over the stomach, and extends off the right side of the ultrasound screen. The ultrasound examination needs to be completed in this animal to search for a possible primary neoplasia or cause of the liver nodules. Biopsy of the hyperechoic liver and hypoechoic liver nodules should be considered. This video shows large hyperechoic nodules in a dog with primary liver cancer. The liver is generally enlarged and contains multiple hyperechoic lesions. In most cases, a definitive diagnosis cannot be made by ultrasound appearance alone. Biopsy is necessary. Benign nodular hyperplasia can occur as single or multiple hyper or hypoechoic nodules of variable size. The nodules can be microscopic and seen only on histopathology, or they can completely fill the liver, as seen in this video of an asymptomatic dog with a moderate elevation of serum ALT. This liver is generally enlarged and nodular.